Assalamualaikum. Hi, good morning, everyone. All right, my name is Nuralina, and I'm with my team, Dr. Shamila Muhammad Syidan and Dr. AP Azli bin Gunawan. And our topic, we will discuss about health information seeking behavior and socioeconomic influences among parents of children with autism, spectrum disorder, ASD, implication for support and intervention. Autism Spectrum Disorder (ASD) is a worldwide public health concern that poses unique challenges for both people on the spectrum and their family. It is critical that the world recognize the magnitude of the problem without discrimination based on the socioeconomy. The goal of this study is to look at the relationship between health information seeking behavior or HISB and socioeconomic factors in parents of autistic children, as well as the implication for support and therapies. Alright, health information seeking behavior is the process on addressing health promotion and individual actively seek for and use of medical condition. They are looking for information, parents, they are looking for information about various elements of autism, such as early intervention programs, educational services, therapeutic interventions, support groups, and coping skills. Referring to Martin, they mention parents who have children with autism confront distinct challenges and duties. Their responsibilities extend beyond day-to-day caregiving as they assume a pivotal role in searching for and securing suitable resources, therapies, and educational opportunities. And again, the timely acquisition of pertinent information becomes paramount, enabling them to make well-informed choices concerning the most effective intervention and support for their children's growth and welfare. However, with the understanding the complicated interaction between information seeking behavior and socioeconomic circumstances among parents of autistic children is critical for several reasons, such as improving their outcomes for autistic children, policy implications related to the autism awareness, healthcare access, and equitable system, and other than that, enhancing parental well-being of parents by providing them with more effective tools and resources to navigate the challenges associated with autism spectrum disorder. It is because from the previous observations shown where there are changes in cultural barriers and demographic creating challenges for parents, children on the autism spectrum disorder, such as low income, unmet community needs, and financial support. Although parents are actively seeking the information, but it is critical to recognize that this behavior does not exist in isolation. Rather, it is inextricably connected with the broader socioeconomic dynamics, income level, educational background, healthcare, accessibility, and geographical location. All of these, they have a significant impact on how parents connect with how they interpret and how they use the knowledge. The goal of this literature review is to get a better knowledge of the current state of research in this field. Autistic parents actively seek information regarding the nature of ASD, early intervention tactics, therapeutic therapies, educational resources, support networks, and coping mechanism. The desire is to give the greatest possible care and support for their children's growth and well-being drive these information needs. However, result from the previous research shows that there are some issues in socioeconomic percentage of health information seeking behavior among parents of autistic children. The activity of information seeking is getting slower because of the information are not related to them, and some of the parents are struggling to obtain a relevant information because of having lower level of information seeking skills. The nature of the accountability and role of parents of children with autism spectrum disorder have changed drastically time to time in different areas of information seeking behavior. Parents' health information seeking in the context of autism spectrum disorder, where we'll discuss about the children who are affected with ASD will triggers the parents are looking for the solutions and research without boundaries. They are not just the primary carriers but also champions and decision makers for their children's well-being. Information searching becomes a key tool for parents navigating the intricacies of autism. Parents addressing topics such as early interventions, educational services, behavioral therapies, and managing associated challenges. Parents also want to learn more about accessible support services such as support group, respite care, and financial aid program. Indirectly, in a survey of children late diagnosed with the ASD in Malaysia may be impacted due to parents in Malaysia having limited knowledge or information about children with autism. From Malaysian perspective in Malaysia, referring to Hamza et al., he mentioned about 762 articles has been reviewed systematically, and from the only 32 articles were qualified in the search for health from Malaysia perspective. And the rest of 22 articles was out of the team from the previous research. The researcher mentioned from the 762 papers was successfully obtained showed that there are no studies relating health information seeking in Malaysia are focusing on autism spectrum disorder. So it will be a higher percentage for children with autism ASD in Klang Valley or in Malaysia areas, and it will be the benchmark for other states if this study will be focused on. When we look at into the socioeconomic factors, parents of autistic children's information in their information seeking behavior basically influenced by socioeconomic characteristics, which include income, education, occupation, access to healthcare, and geography. And results show that the most respondents live in the rural areas with low levels of educational attainment or socioeconomic status. Most respondents only maintain follow-up appointments with the hospital and continue to advance their children at community-based rehabilitation center (CBRC) in Kota Baru. This one is referring to Shukri et al. In 2017 research. Often in many cases, several authors mention also on caring for a child with a disability contributes to higher levels of stress. And it highlighted on the previous paper where parents will face concurrent challenges such as the financial burden and time of medical treatment, parenting, and family changes. Most of the parents with lower income levels are complained about the financial burden that they have to fulfilling the basic burden that they have to pay up for everything, including basic needs such as high cost of food, transportation, medication, and they also rely on freely accessible services, government-funded initiative, or neighborhood assistance. In data and methodology part, a survey on health information seeking behavior among parents and socioeconomic influences among parents with autism was developed to validate the suggested framework and meet the goal of this research. So the survey aims is to look at the potential determinants and relationship between socioeconomic attributes such as parent age, qualification in education, and occupation that may influence parent health information seeking behavior. So this research is one of the contributions that has investigated deeper aspect of HISB among parents of children with ASD attributes by linking socioeconomic attributes that positively used and related to the implication for support and intervention. So for the future research might focus on confirmation of the above relationships in other setting and enhance another seeking process guidance for parents in health information seeking behavior. In this part, we will touch a little bit about the underpinning theories and models related with autism spectrum disorder, where previous studies have been referred to several models that related to the health information seeking behavior, parents of autistic children, and it related with the socioeconomic influences. And based from Longos et al. Expanded model of health information seeking behavior, he's investigate through parents' age, education level, income, and occupation that can create their health information seeking behavior in finding the health information. Therefore, this paper aims to discuss on how socioeconomic factors may influence health information seeking behavior among parents with ASD. And in this slide, I bring four factors which influence the socioeconomic. One of it is a parent's age, qualification, income, and occupation. And a part of socioeconomics, one of the factors is the parent's age, where one of the notions associated to the information seeking behavior is the influence of personal characteristics like age, like gender, income, and educational level. Number two is the qualification, where several research demonstrated low family social income status is one of the factors that affect the way of health information seeking from parents with a low education level and household. And referring to Sharabi, she mentioned that compared to parents with high level of education qualification who will actively involve in children's health information seeking for the development of children with ASD. The third one is about income. So results shown on a household in urban or rural area did not seek health care information because of they were lack of money, long distance, and symptoms were not severe. Where in China, according to he et al., he concluded that children from low-income families and those with less education were more likely to develop autism as a children. The last one is the occupation, where career adaptability of parents of children with autism spectrum disorder. A complex neurodevelopmental condition is a multifaceted phenomenon that requires them to navigate an intricate interplay of caregiving responsibility, understanding the unique needs of the children, assessing diverse resources and support networks, advocating for tele-educational and therapeutic intervention. So from here, there are four significant themes that have arisen, indicating trauma or changes in work-like behavior following ASD, career adaptability, the effect of the COVID-19 epidemic, and a post-interview knowledge of a specific sample. So in a summary, you can see, as presented in figure 1, there are four factors. There are four factors of socioeconomics that may influence the HISB among parents with ASD. As a conclusion, in order to determine whether the information retrieves successfully or fail, it comes from demands upon formal and informal information. If the user feels satisfied with the result, the individual will make use of the information either in fully used or partially. With the different socioeconomic level and structural status with the limited access also will be part of the deterrence HISB challenges. The significance of this study is to address the gaps issues in the existing health information seeking behavior and socioeconomic influences among parents with ASD children. Indirectly, it can lead to improve the socioeconomic influences for the betterment. It stands for not just the search for solution, but also for a better future for their children as well as hope and empowerment. Thank you and Assalamualaikum.